For today's Wellness Wednesday, let's talk about something that everyone experiences at some point in their life, back pain. Whether it's something you did or it's a chronic issue you suffer from, the question remains, what can you do about it?
Dr. Brendan Bentley is with the Department of Family and Community Medicine with WellStar MCG Health, and he's joining us this morning with student Dr. Peter John Williams to discuss the connections between both.
Hey guys, thanks for joining us.
Appreciate it.
Well, student Dr. Williams, how common is back pain?
So back pain is actually a very common disease that affects many people. Just in the United States alone, up to 85% of the population will experience back pain at some point in time. And worldwide, it's actually the leading cause of lived years with a disability. Just to give a couple more numbers, just to kind of home in on it, it's 2 to 3% of ED visits are typically caused by non-traumatic back pain, meaning that people just got up and just feel like their back's hurting and now they're in the ED for it. So if you rolled out of bed, that might be a reason why.
We literally just talked about that.
Yeah, exactly. So just to give that an idea. And then just to kind of hone in more, there are different types of back pain. So there's acute back pain where it's less than 4 weeks. There's chronic back pain, which is greater than that by a good mile, like by 12 weeks. So depending on which, you might have different statistics that factor into it.
Dr. Bentley, what are some causes of back pain?
So we touched a little bit about that. You know, there's the I woke up on the wrong side of the bed,
yes,
which seems to happen overwhelmingly frequently. A lot of people just have this nonspecific, vague pain that comes on without incident. However, there's also traumatic causes of back pain. So a fall, a trip, that if you lift something heavy, that you use a little bit too much of your back and not enough of your legs, perhaps twisting awkwardly or participating in an event without warming up properly. But those are all of our musculoskeletal causes, and there are some non-musculoskeletal causes as well. So sometimes it can be an infection, or sometimes it can be an internal process that's referring pain to the back, and we don't want to miss those. So while we often think about twisting a little bit weird, sometimes it's something else.
Mm-hmm.
And when is back pain a serious problem that needs to be addressed?
So we talk about red flag symptoms for our big ones that we don't want to miss. They're anyone who has back pain over the age of 50, if you have associated loss of the function of your bladder or bowels, if you are unable to feel the sensation, if you're touching your legs and it feels numb, or if you lose the ability to maybe move your legs in a way that was previously pretty easy. So if you lose strength or mobility. There's also, fever associated with your back pain, or suddenly waking up at night on a frequent basis, or even weight loss. Those are some of our red flags that make us think this is something more than just that vague, non-specific injury.
Dr. Williams, how can, and because I'm having it right now, how can I prevent frequent back injuries?
Well, so going for you, making sure that if you get up out of bed or anything, you get up on the right side, you've slept properly, you don't just like roll off onto the ground. That'd probably be a good start there.
That's what happened. He's not lying.
Besides that, there are very simple things you can do even while at work. If you have a desk job and you're constantly sitting down, making sure that the chair is appropriately postured so that your spine is supported and you have the computer or the monitor at eye level, so you're not bending your back or compromising your posture in order to make your job go by faster. Other things you can do is if you're standing for long periods of time, making sure that you're well supported so your posture isn't compromised. In general, just making sure you ensure a neutral spine. That's a very effective thing to do. And then there are things that are associated with back pain, such as obesity and smoking use. So if you can maintain your appropriate body weight and decrease on the smoking habits, that could really help as well. Activities like Tai Chi. Tai Chi has actually been found to be very good in terms of helping with back pain. And then making sure that you see doctors like Dr. Bentley if you have any of these concerns. Make sure they get seen earlier rather than later, so you don't miss like a red flag symptom.
Any particular places you can go to get more information if you have issues with back pain?
Yeah, so I know that we mentioned it, but coming and seeing your doctor,
yes.
If you have some back pain that you have questions about, or if it's just lingering longer, if you're having a symptom that you're uncertain of, feel free to reach out to your doctor, talk with them about it, see if there's something more that needs to be done, or if you need to look a little bit deeper. Most of your doctors are happy to talk with you about any concerns that you have.
All right, doctors, appreciate it very much. Thank you for the assist. And remember, roll out of the bed if it hurts, like it happened on Monday morning. All right, the mutual exchange of benefits or privileges. That's the definition of our next segment in just a few. Right now, we're heading to weather with Tim. See how the weather's looking out there today.